Welcome to Popular Pulmonary Wellness. Today, we're going to be talking about the mental health aspects of living with a chronic lung condition. And we have a guest speaker today. This is Cynthia. Cynthia is a Canadian certified counselor and a registered social worker. Cynthia, thank you for joining us today.
Oh, thank you for having me.
So we know that there are different professions that people can work with from a mental health perspective, such as psychologists and therapists and counselors. So could you maybe start us off by telling us a little bit about the difference between these professions?
Sure. Yes, psychologist would be actually, you could receive the same services from all of these professions. One main difference would be that a psychologist is able to assess and diagnose, whereas a therapist counselor is not making diagnoses. But basically, you can receive mental health services, counseling services, therapy services from all of those professions.
Amazing. How would somebody go about finding a mental health professional to work with?
So you can use Google. You could go on the Psychology Today site. So just typing in Psychology Today and the area that you live. On there, you will find all sorts of verified mental health professionals. So these are people who are reputable, and their credentials have been verified to ensure that you're getting somebody who is credible in terms of their expertise. Yeah. Does that answer?
Yeah, a little bit. I know I was looking for a counselor recently, and I was using Google and looking on different websites, and I noticed that a lot of the counselors put a blurb about themselves and about the way that they practice. And I found that was really helpful to me to try and find somebody that I can connect with. Um, and then other than, trying to find somebody who you have maybe can find a connection with, um, also funding might be a factor for some people as well.
Yes, yes. So depending on your benefits and what health benefits you have with your insurance, that's something to look into, whether or not your benefits are whether or not you're looking for a psychologist, a social worker, or a counselor. That's important. Looking for, what expertise, whether or not they have expertise in the area that you're seeking counseling in. So, for example, with chronic illness, you want to make sure that the person has expertise and in that area.
Awesome. Yeah, I think a lot of people aren't aware that specific counselors might actually work with specifically people with chronic conditions. So that's great. Thank you.
Mhm.
Um, so the mental health component of having a chronic illness is something that sometimes catches people by surprise. People might not anticipate having all of these things to deal with, such as anxiety and depression. They may have fear. There might be a feeling that life is not quite as enjoyable, sort of a hopelessness and grief. These are a lot of pretty heavy emotions. Um, how might a counselor be helpful to these people? Like, why would somebody want to seek out a counselor?
That's a great question. Um, I think a counselor would really be providing a safe space, a safe, supportive space for somebody who's dealing with anxiety, depression, all of those heavy feelings, hopelessness. So, providing a safe space where you can just talk about what your experience is, what you're going through, what your thoughts and feelings are about what you're dealing with on a day to day basis. So it can really just be a nice place to come in and just get out what your struggles and challenges are that you're facing.
Yeah, they say that everybody should have a counselor. I've heard that from many different people, and it seems that people who do have a counselor really do appreciate having that resource in their life.
It can be a really wonderful resource. Sometimes you don't want to be a burden to friends and family. You don't want to be constantly feeling like you're going to friends and family for that support. And this can be a really nice, unbiased person that you can just express anything and everything that you're going through with. But not only that, you can also, it's a nice space to problem solve, to come up with some solutions on different ways that you can cope with what you're going through, figuring out coping strategies so that you can increase your well-being in your daily life.
That's amazing. And as you're speaking about all these emotions and providing support and not wanting to be a burden, here at Poplar Pulmonary Wellness, we also work with caregivers. And so so it's not only the people who have the chronic illness, but the caregivers are often going through even more of an emotional burden because they feel this empathy, and they are somewhat burdened in providing the care. So this is another group of people that may also benefit from seeing a counselor.
Yes, that's a really good point. Absolutely. Caregivers take on a huge burden. They're wanting to give of themselves to care for the people who have chronic illness, and yet can feel depleted and can feel overwhelmed with their day-to-day caring for their loved one.
And then seeing a counselor would be something you would recommend for caregivers as well then.
Yes, absolutely. Anybody facing struggles, emotional struggles, mental health struggles, it's very beneficial to seek out a counselor.
And does somebody need to have a physician referral to see a counselor?
That would depend on your insurance. So whether or not you are covered. If you have insurance, you'd need to check into that to see whether or not you need to have a letter from a doctor, because insurance are different. So some plans you don't need to have a letter, and others you do.
Okay, thank you. Good to know. So people should look into their insurance plan if they have one, see what's covered, and it should list the healthcare professionals that they do provide coverage, and it should explain to you what the coverage is. And then it would also say if they needed to have a physician referral for that.
Yes. Yes.
Great. And then if they weren't sure, or if they felt like it was more of a crisis, they could reach out without a physician referral, but they would generally have to pay for the service themselves then. Is that right?
Yes. And in a crisis situation, though, I would always direct people to maybe the distress center or crisis intervention center in your area. That's usually open 24/7 if you are having a crisis in terms of mental health. So because that service is available to you right away. So if it's a crisis, a counselor or therapist may not be able to get back to you right away and may not even be available right away to start services. So that's always a good option as well.
So one thing I noticed that I read on my counseling website, like the place that I ended up going, was it talked about uh, like exploring your emotions and feeling comfortable versus feeling not comfortable. And it talked about you want to kind of hit that point of feeling a little bit uncomfortable because that's where you're pushing through and dealing with the problems that you're having. But for the person to recognize the difference between feeling a little bit uncomfortable versus feeling like they're not in a safe space. At which point, if you feel like you're not in a safe space, or you don't feel safe, to expose yourself emotionally, with the counselor, that maybe that counselor is not right for you, or maybe there's something in that relationship that isn't right, versus are they pushing you in the right way, in a tender way that will help you deal with whatever it is thing. So it was a really interesting blurb about being comfortable and uncomfortable, and are you uncomfortable in the right way versus uncomfortable in maybe not the right way, you know?
That's interesting. Yeah, I think I have something like that in my information. My intake form talks about like the risks and benefits of counseling, and talking about how a risk is that you might feel uncomfortable talking about
Right.
feelings, talking
Yeah.
about what's going on for you, and
Yeah.
that can be a risk. Counseling is tailored to each person, and so it really is about what is right for you, and the client leads. So
Nice.
I'm going to work with you and where you are comfortable going. I'm not going to try to push you out of your comfort zone.
Counselor. Maybe could you tell us a little bit about what they could expect out of a first session when they do go to see somebody?
Yes, so absolutely. If you've never experienced before, it can be very intimidating to think about going to a counseling session or seeing a counselor. Number one, I think it's important to remember that everything that you talk about in counseling session is confidential. So it is between you and the counselor cannot disclose that to anybody without your written consent to disclose. So that way, you know that is your safe space to talk about anything that is going on for you, and that won't be spoken about to anybody else. In a first session, I think the counselor would like to really get to know you. Who are you? Who are you outside of the problems that you may be coming with? So that is really important, as well as then to get to know the problem. How is it impacting you in your day-to-day life? I think it's important that you feel comfortable with the counselors. Sometimes it can take a couple times of, seeing maybe a couple different counselors to really feel like you've gotten a good fit, which is normal. And you may want to try one session with one counselor and try another session with another counselor just to see who you might fit with better. Another thing that's really helpful, just sort of backtracking to when you're seeking a counselor, is that most all counselors offer a 15-minute phone consultation. So you can talk to them on the phone and you can kind of get a feel for whether or not it's a good fit for you through that conversation.
Oh, that's super handy to know. Thank you for that.
Yeah.
And our population also, there's a lot of people who need to have oxygen, and so traveling to an appointment with oxygen can be quite cumbersome and a little bit limiting as well. I know that you provide online counseling services. Is that something that other counselors will provide that people can look for?
Yes. So I think generally most counselors these days are offering in-person as well as virtual appointments. So I would check to make sure and ask them, because not everybody is. I think you often will have the option too of like video or phone appointments as well. So if you feel more comfortable doing a phone appointment, that could also be an option, as well as like a Zoom appointment.
Amazing. Thank you so much for giving us all this information, Cynthia. Thank you for joining us and exploring this, the mental health side of a chronic illness. I think it's something that people don't always expect as needing to deal with as part of their illness, but it's very much a part of it.
Yes, because you would seek a doctor if you're having physical issues and physical problems. And it's important to seek a mental health counselor if you are having mental health struggles, emotional struggles, intense emotions that you're uncertain how to cope and deal with. There are trained professionals that can help you deal with that and can help you with the impact of the chronic illness that you're dealing with.
Then I'll just say thank you, Cynthia, for joining us here today. We really appreciate the input and advice that you were able to provide. So thank you once again.
Wonderful. Thank you for having me. It was a pleasure.